Hi everyone, I am Dr. Bafna. I am an orthopedic surgeon specialized in arthroscopy and joint replacement. Today we will going to talk about the meniscal injuries. What is meniscus and how do we treat meniscal injuries? This is very common question and I will here to explain you about the meniscus. So meniscus is a very important structure present inside the knee joint. So if you can see in this knee model, there are two donut shape or C-shaped structure present in between the thigh bone and leg bone. So this is we called as a meniscus. So there are two type of meniscus inside the body. One is inside, that is medial meniscus. One is outside, that is lateral meniscus. Meniscus is a very important structure inside the knee joint. It provides a cushioning effect to the knee joint and it is a shock absorbent to the knee joint. So sometimes while doing a pivoting activity or cutting activity, or if we fall on the knee, or if we fall while playing any game, we can experience a sudden sharp shooting pain inside the knee joint. That can be your meniscal tear. Sometimes it presents isolated meniscal tears, or sometimes it combines with the ligament injuries like ACL tear or PCL tear. So how do we diagnose meniscal tear? Clinical examination may we do a specialized test, but apart from that we order a MRI to diagnose the meniscal tear. MRI will tell us which grade of meniscus is there and in which zone meniscus is torn. So there are three grades of meniscal tear, that is grade 1, 2 and 3. Usually grade 1 and grade 2 we try to treat it without surgery, but if you have a grade 3 tear, that means if there is a complete tear of the meniscus, we address it surgically. So there are three zones of meniscal tear. So if tear is present inside area of the knee joint, then we called it in a zone white area, and if it is in the periphery, then we called it as a zone red area tear. So depend on that we decide which kind of treatment we provide to the patient. So there are two type of treatment present surgically. One is meniscectomy and there is another treatment called meniscal repair. So there is a lot of confusion about it, when to do which and how effective is each treatment and what are the effective side effects of it. So meniscectomy usually we do if patient has an old tear, complex tear whose healing potential is completely gone, or it is a small teeny tiny tear present especially inside the knee joint at the white area. So we treat it by doing a partial meniscectomy. So there is a small risk of arthritis following the partial meniscectomy, but if meniscal tear is too small, the risk of arthritis is very less. If tear is very fresh, present in the periphery zone of the meniscus, that is red area, and relatively less complex tear, we manage it with the meniscal repair. Meniscal repair is a very good surgery. We try to preserve entire meniscus, but it adds to a cost to the surgery. And second thing, your rehabilitation is relatively slow as compared to the meniscectomy. Very rarely, if meniscus do not heal, sometimes patient may need a second surgery to remove that fragment. So as and when possible, we try to preserve meniscus as much as possible. But sometimes if tear is non-repairable, we do remove it without hesitation, and patient do get the best outcome in both the scenarios. If you have a meniscal tear and meniscal tear related queries, please do connect with us on Cure India platform. We are happy to help you.
لو تريد العلاج في الهند لا تنسوا الإعجاب في الفيديو والاشتراك بالقناة ليصلكم كل جديد من كيور إنديا.